Hello, and welcome to the NYU Langone Dental Medicine Postdoctoral Residency Program's Advanced Education in Pediatric Dentistry program. This is Dr. Stephanie Campbell. I am the Chief Resident at the Yakima, Washington site, and I'll be telling you a little bit about our program today. So we are based in Yakima, Washington. Washington is known as a very beautiful outdoor state. This is a picture of Mount Rainier, which is one of our most famous landmarks, of course. It's a national park and it's absolutely stunning. You can see some Indian paintbrush, which is my favorite wildflower, in the foreground here. Just a really nice state to live in. We've got beaches and mountains and everything that you could ever want. Washington is fabulous and hope you can visit. As far as our program goes, we were started actually as a satellite residency as part of the University of Washington. And in 2012, the program transitioned to Lutheran Medical Center, which later formally became part of the NYU Langone Health System in 2016, and we've remained thus since then. As far as our program goes, just the basics, it is a 2-year program. We have 6 residents, 3 per year. You can see in this photograph, this is our most recent graduating class. So the 3 on the left side are the most recently graduated second years, and the 3 on the right are myself and my 2 co-residents. We have 4 full-time attendings, so it's a pretty good ratio between the number of residents and the number of attendings. And we split time mainly between 2 different clinics, ViewCrest Pediatric Dentistry and Children's Village. And I'll talk about those 2 specifically a little bit later on. So we have fabulous faculty here. Our associate director is Dr. Jessica Webb, and also we have Dr. Jessica Kennedy that work mainly at Children's Village, although sometimes they do float between the 2 clinics. They're both a wealth of knowledge in patients with special health care needs and very easy to approach and totally wonderful attendings. I can't say enough good things about both of them. At our ViewCrest Pediatric Dentistry Clinic, we have Dr. Joseph Wilson and Dr. Dave Purcell. They're both graduates of this program and are really invested in the community. They are extremely good teachers, and we're very lucky to have them as our attendings. So a little bit more about ViewCrest. ViewCrest is kind of our bread and butter dentistry. It's private practice style. We are fortunate that we are in a medical dental building where we have a dental clinic upstairs and the medical clinic downstairs. This allows a lot of interprofessional communication, and we also share the same medical record EHR system, Epic. And so it's really easy to see patients' medical history. If we need to do a medical consult, we can just send a message. So it's really convenient to have them downstairs. It's also convenient because if we need to do a COVID test, we just have them pop downstairs to do that. Our clinic has 2 quiet rooms and 7 operatories. So the operatories are somewhat open bay, and then the quiet rooms, of course, can close the doors. The quiet rooms are where we see sometimes patients with special health care needs. It's also where we do our oral sedations. And we also have a resident room, which is pictured in the lower part of this slide. Each resident has their own desk that you can decorate and, kind of make a little home for yourself at. You have your own computer. You never have to worry about, sharing a computer or anything like that. So it's just a really nice clinic. And then Children's Village is our other clinic that we spend time at, and it's a really, really awesome clinic. It has over 30 services for children with special health care needs and their families. So it has all of these things for these patients under one roof. We have dental, where we have 4 different operatories and 2 quiet rooms. And in these pictures, you can see our dental clinic. So that's one of our operatories. On the right is our hallway. We have really pretty murals, and the walls at Children's Village all have sensory textures on them and different colors. So for patients with sensory things. They can kind of touch the walls and it kind of makes them feel a little bit more comfortable. And the whole thing is kind of barn Western themed. So we have our corral instead of our waiting room, and you can see that in the lower part of this slide. So at Children's Village, there's not only dental, but there's also different medical specialties like cardiology and neurology. There's behavioral therapy, and there's occupational and speech therapy. So a lot of these patients do multiple services here, which is really convenient for them that they don't have to go back and forth to different clinics. And we also have a lot of coordination between Children's Village and our local hospital, as well as Seattle Children's Hospital and the Yakima Valley Farm Workers Clinic, which is the main clinic that we operate out of. So the hospital that we mainly work with is Virginia Mason Memorial Hospital. It's the hospital that serves basically the entire Yakima County, and it's also where we do our OR cases. So we typically do our cases that are a little more medically complex, or some of our older patients here at the hospital. This is also where we take after-hours call. So when you get called in to go for a dental trauma or infection, you're going to be going to Virginia Mason. We also do an emergency department rotation here and an anesthesia rotation during your first year, where you'll learn how to intubate patients. You'll get to interact with the emergency docs and get to know them, so that once you do come in to do your hospital call, you actually know people and kind of know how the ED is run. And we also do an inpatient pediatrics rotation here, and normally that's done at the end of first year. As far as our other rotations, we also have outpatient pediatrics in addition to the inpatient rotation I just mentioned. Our outpatient pediatrics is done at Yakima Pediatrics. We spend a week over there just kind of observing well child checks and other patients as they come in. We participate on a cleft lip and palate team. So the team is made up of ENTs, plastic surgeons, orthodontics, speech therapy, genetics, us, and sometimes other services as well. And that's really cool because we get to see a lot of the progression of patients with cleft lip and palate and really get a better understanding of the management over the course of a patient's life. We also do a cardiology rotation, and we do developmental behavioral pediatrics and get to observe in the autism spectrum diagnostic clinic. And those three are all at Children's Village, as is genetics. So really good for getting a good handle on learning about patients with special health care needs and getting more comfortable in treating and managing those patients long term, as well as getting to know the providers that are seeing them in those departments and furthering that interprofessional education. As far as our clinical experience goes, we are very lucky that we have a very busy clinical practice here. Between our two clinics, we see a lot of patients. At both clinics, each resident is responsible for managing 2 to 3 columns. So you have usually a column of restorative treatment and a column or 2 of recalls and or emergencies. It's very private practice style in that we have 2 restorative hygienists that can give local anesthetic. They can fill for you if you like. And we always have at least 1 dental assistant per resident. So you never have to worry about, doing your own cleaning of the operatory or, that kind of stuff, which is really nice. Our assistants are the absolute best. We have a really good time getting to know them. You can see us this year on the upper right and lower left, the Halloween costumes that we did at our different clinics this year. We were Mario Kart themed at our ViewCrest clinic and Wizard of Oz themed at our Children's Village clinic. In the upper right-hand corner, that is me actually doing some general anesthesia in office. And on the lower right is our anesthesiologist, Dr. Dobell. She's the main anesthesiologist that we work with when we do our in-office cases. And I'll talk a little bit more about that in just a moment. And then the upper right corner is Dr. Trujillo and myself at the hospital we were doing some after hours call. So in addition to our typical bread and butter dentistry, we do a lot of advanced behavior guidance techniques. We are really fortunate in that we get a lot of experience with general anesthesia and oral sedation. So we get, on average, about 125 general anesthesia cases, and that is both done in our office and at the hospital at Virginia Mason. So we're really fortunate to be able to manage kind of how that would work in a private practice and at a hospital setting. And for oral sedation, we're lucky enough to have an average of about 30 oral sedations per resident. So that is something that our clinic is really strong in. Our assistants are very well trained in doing sedation, and it's a really great experience that we have at this program. The other strengths of our clinical training, we do a lot of silver diamine fluoride applications and ITR. So that's been really important in the coronavirus, trying to do procedures that, take care of pain, but maybe not generate as much aerosols. We also get experience with the use of lasers, doing frenectomies and soft tissue pathology like biopsies of mucoceles and stuff like that. We get experience with zirconia crowns, especially in the anterior, which is really nice for our patients as far as aesthetics go. And of course, we do a lot of stainless steel crowns and typical restorative treatment as well. And then we also are pretty well trained in space maintenance, doing crown and loops, band and loops, TPAs, all that kind of stuff. And just management of the developing dentition, especially with early tooth loss or other issues. And then we also have really good training in resin infiltration. We use the ICON system here to do that. And that's been really successful for some of our patients with hypoplasia or for patients that, have just the start of caries that's extending towards the dentin, and we can kind of help stop that. And then finally, pulp therapy. I've already mentioned sedation. We have good behavior management techniques. We use nitrous oxide a lot, but also we have TVs in our operatories. We're well trained in managing behavior of all sorts of patients. And of course, the management of special healthcare needs. We have really strong training in that last bullet point, especially at our Children's Village Clinic. As far as our didactic learning goes, we have local classes that our attendings teach. So each one of them will teach various topics that I'll talk about on the next slide. We also have a local literature review, and our residents participate in the VTC through NYU Langone, where all the other NYU Langone residents are participating in video conference lectures on various topics. And that's really cool because you get to see other programs and we're all learning this together. And that's kind of a unique thing about this program. As far as board preparation goes, we are pretty well prepared. All of our residents have passed the QE exam, and so hopefully this year with our second year class, myself included, we'll continue that trend. So the topics of the local classes that we have behavior guidance, both non-pharmacological and pharmacological. We have growth and development, prevention, trauma, pulp therapy, dental materials, management of cleft lip and palate, various special needs courses. We have leadership and professional development classes and also ethics. So we get a really well-rounded didactic learning here, specifically at our Yakima site. And our attendings are all experts in the topics that they teach, and they're super knowledgeable and give really good information. Our literature review, we do a weekly review and discussion. So we read various articles in pediatric dentistry. We cover the reference manual and the AAPD's handbook of pediatric dentistry. We've been doing some questions through the handbook to kind of better prepare us for boards. We also read pediatric dentistry textbooks. Some of them are pictured on this slide. So a lot of reading at this program, but you definitely get a lot of information and really good didactic training. Outside of clinic and outside of studying, we have a really strong sense of community involvement and giving back to our patients. So we do a lot of volunteering here. These are just a couple of our events that we've done this past year. When the coronavirus pandemic hit, Yakima actually implemented a mask mandate earlier than some of the other areas of Washington. So we volunteered to distribute masks for free to various members of the community. They drove up and we gave them masks, and that was really a fun event. Trunk or Treat is done at our Children's Village Clinic. It's a safe place for the patients of Children's Village and their families to come and dress up, and they get, at other stations, they get candy. At our station, of course, they got toothbrushes and toothpaste and other little toys, because we weren't about to give them carcinogenic foods. And then also we do various health fairs where our theme is typically superheroes. And so we have residents dress up as superheroes and interact with kids and really get them excited about dentistry and their overall health. So those are just some of the events that we've done. There's others that I haven't pictured here, but volunteering is super fun with the co-residents and just really getting to know the members of the community. Other extracurricular opportunities that we have a relationship with the University of Washington LEND program, which is leadership education in neurodevelopmental and related disabilities. And it's aimed at training clinicians to be leaders in the field of developmental disabilities. So just additional training on helping patients with developmental disabilities and kind of managing them throughout their lives. And one of our residents, Dr. Johnson, our second year, she is participating in this program this year. And typically we have 1 or 2 residents participate each year. We also participate with Special Olympics. So we have dental screenings at the Special Olympics Games. There's normally a regional soccer tournament in Yakima, and there's also the Washington State Summer Games that we send residents and attendings to. We'll do screenings and, oral hygiene instructions, and that's a really cool thing to get to know some of the athletes and really get them, informed about their teeth and kind of get them treatment, or at least, seen by somebody if they do have dental needs. As far as advocacy goes, we have a close relationship with the Washington State Academy of Pediatric Dentistry. They sponsor residents every year to attend the AAPD Public Policy and Advocacy Conference. So I was fortunate enough to be selected for that this year. You can see me on the upper right, and then on the upper left picture, that's the NYU program with Dr. Kane in the front, and all of the NYU residents that were able to attend this past year. And then you get to meet with Congress people, interact with other residents and other pediatric dentists from your area. And it's really cool to be able to talk with legislators about public policy and dental and really inform them on the issues at hand. And then we also have the opportunity to attend the state annual meeting. Usually that's held in October. And so we have a nice relationship with that organization. We also, as part of the Washington State Academy of Pediatric Dentistry, they have a foundation that helps support the residents, and we have the opportunity to be student member of the board and also apply for a resident research grant, which helps us fund our trip to the AAPD conference where we present our research, or helps cover the cost of other research that we're doing during our time in our program. So that's basically everything that I have on the program itself. And you might be wondering, where exactly is Yakima? It's not a well-known city unless you have heard of the car boxes. Those are made here, the little things that go on top of your car. But the Yakima Valley is actually in Washington State, as I mentioned before, and we're kind of in the middle of it all. We're in central Washington, and we're kind of nestled between Seattle, Spokane, and Portland. And we have a very nice size of the population. In Yakima itself, we have about 93,000 people, but the whole county, which is the population that we serve, is a little over 250,000. So it's certainly large enough to provide us with a lot of patients and, good interaction, but also not so large that you're fighting traffic and it's expensive to live. So the main industries in Yakima are healthcare, retail, trade, and agriculture, forestry, fishing, and hunting. But of course, there's other industries as well. The climate is a semi-arid desert, and we're lucky enough to have 300 days of sunshine each year and 4 seasons. So even when it's cold in the winter, it's very sunny and beautiful. And overall, it's really dry here. There's low humidity, and it's pretty mild conditions in general. We do have a small airport here, so you can fly directly into Yakima. You can also drive to nearby airports at Seattle, Pasco, which is about an hour away, and then Portland and Spokane airports as well. So that's really easy to travel here, and it's nice that we have our own airport. It is a very small airport, like I said, and you never have to wait really for security, which is awesome. So some fun facts about Yakima. We are the #1 apple producer in the country. So I mentioned that Yakima is a big agriculture producer, and apples are the most famous thing that is produced here. But there's lots of other fruits that come out of here too: peaches, cherries, especially blueberries, pears, peppers, all that kind of thing. We also are the #1 producer of hops in the country and one of the top producers in the world as well. So over 77% of the hops in the US come from here, and we have beer makers from all over the world that come here to sample the hops and collect hops for their beer in their different countries. And so because of that, we have some great local breweries that are, really awesome and do a lot of information on kind of how the hops industry is working and the growth process of the hops and all that stuff. So it's really cool to learn all about that and see the hops. They're actually quite beautiful. They have these big vines, and the hops are kind of like little trees, I think they look like. And then finally, the Yakima Valley has over 50 wineries, so it's a really great area to produce wine grapes. And anything that you see that has Columbia Valley on it is from this area. There's really great wine tasting. They're really beautiful, beautiful vineyards. You can see one of them pictured in this slide. That mountain in the background is Mount Adams. So from Yakima, you can see both Mount Rainier and Mount Adams, and just really nice wineries to go to. Aside from wineries, there are a lot of other things to do here in Yakima. There's a lot of outdoor recreation, so there's water skiing at some of the nearby rivers and lakes. There's also snow skiing. So the upper right picture in this slide is White Pass, and you can see Mount Rainier in the background. It's just a really nice smaller resort that's never too crowded. There's fishing, especially fly fishing, and boating here as well. And there's really great hikes nearby. We have the Cascade Mountains, we have Mount Rainier National Park, so really, really beautiful. And you can also go whitewater rafting on some of our rivers. And in Yakima proper, there's some museums and theaters that are really fun to go to. So you can see the Capitol Theater in the bottom. They do different plays and concerts and stuff like that. And fruit picking, as I mentioned earlier, is one activity that's super fun to do here. That image in the upper left is my hand holding a massive blackberry. So all the fruit here that you can pick is really cheap, and it's super fresh and delicious. You can pick blackberries, you can pick apples like you can see in the lower left. You can pick peaches and cherries, and it's a really cool experience to be able to learn about agriculture and also get access to that fresh fruit and other agricultural products. There's also a lot of great community events here. We have a Fresh Hop Ale Festival that kind of celebrates again our production of hops. There's things like the Taco Fest, and then other concerts and events throughout the year. And then finally, again, the wine tours and tasting is always a good time. So Yakima, like I mentioned earlier, is kind of nestled in the middle of it all. We are really close to other destinations that you could make for a great weekend trip. So Portland is only 3 hours away. Seattle just a little bit more than 2 hours away. Spokane is 3. So those are kind of the big city things that you can do, if you need to get that big city experience. Leavenworth is about an hour and a half away, and it is a really charming town. It's Bavarian themed, and they have a great Oktoberfest. They are nestled in beautiful mountains, and that's a really fun getaway. And then Coeur d'Alene, a beautiful mountain lake city in Idaho. It's about 3.5 hours away, just a little past Spokane. So there's lots of really great areas that you can go just on a weekend, just to get away and relax from the stresses of residency, but that aren't too far. So the last slide that I'll talk about is just some helpful videos. There's links to YouTube videos from our various clinics, the first being Children's Village. That just gives a little bit better overview of every service that Children's Village provides and gives you kind of a tour of the clinic as well. And the Yakima Valley Farm Workers Clinic has a YouTube channel, and they have a lot of really great videos about their impact on, the community. We have one of Dr. Wilson, one of our attendings, talking about his experience growing up here and, training here and giving back to the community. And then just to learn about Yakima itself, there's some really great fun tourist videos as well, to give you a better sense, since you can't visit, of kind of everything that Yakima has to offer. So I hope that you've enjoyed this presentation. We really hope that you come and visit us someday and have a great experience in your interviews, and good luck to all of you. Thank you very much for your attention.